Good afternoon, everybody, or good morning. If you're in Central Standard Time, then it is afternoon or evening. Good evening, 5 p.m. Greetings from Taiwan, Taipei, Taiwan. It is 6 a.m. here. Coming to you with a new time for the QRA. And so same rules, just different time. So let me do a disclaimer. First, everything that I'm sharing in this QRA Live, which is quick restorative acupressure, everything I'm sharing here is not medical advice for you. It is only experience based on our patient's experience. I'm sharing what happened when physical patients come into our clinic today, and what we do, how we help them with their chronic health conditions. And so, um, yeah, so I'm just sharing the experience of that. I am not telling you this is what you should do. You always need to check with your provider, whether it's a healthcare practitioner, any type of healthcare practitioner, it'd be natural, it'd be Western medicine. You need to check with them before you implement any of the strategies or any of the advice that that I'm sharing today, okay, on this. So for the next couple of months, next 3 months, I'm going to be in Taipei. So we're going to be using this time, Sundays, 5 p.m. Central Standard Time, or Taiwan time at 6 a.m. on Monday, wherever you are in the world. Shoot me a chat. Let me know where you are in the world. Where are you tuning in from in the world? Um, and go ahead, for those of you who are already logged on, just go ahead and put into the chat what you need help with, what chronic health condition that you want help in restoring your health and reversing it, and then also restoring. This is a restorative longevity podcast, so we're talking about restoring your body's ability to heal itself. Your body was built with, God gave you the ability to heal yourself, and we just temporarily lost that ability. Type into the chat what you need help with. And as I'm waiting, I'm going to share a couple of, just a little more disclaimers, and then I'm going to share a couple of things of what um, I say realizations coming into Taiwan at this specific time. Normally I've come to Taiwan around March, probably spring, which is cooler. But this time we came back at the end of summer, and it is still pretty hot, more humid. Okay, but again, coming back to the disclaimer, you can share anything. Type into the chat. First come, first serve. Let me know what you need help with, what health condition that you need help with. I can help you navigate through it, which practitioners to go to, which blood test to go to, what QRA. I can show you some quick restorative acupressure. You just need to type in the chat so I know what you need help with. Um, and yeah, we'll go from there. Okay, so while y'all are typing in to the chat, I'm going to share some of my revelations in coming back to Taipei. So it is early, it's still, obviously early September, so it's still hot. It's still hot in Texas as well. Um, and one of the things that I've noticed coming back is I'm retaining a lot of water. And in Taipei specifically, it is very humid. It's actually not that hot compared to Texas. It's only in the 90s, like 93, 92. So compared to Texas, it's not that hot. Texas is 100 degrees is hot, right? And so it's in the 90s, but the humidity is terrible. In Texas, we'll probably have humidity, at worst, it's 60% humidity. But here in Taipei, the humidity is 80, 84%, 80%, 70, 80%. And so why am I sharing this? If you live in a very hot and humid environment, you are going to retain a lot of water. You need to drink a lot of water. You're going to feel like you're sweating a lot and you're losing a lot of water. But at the same time, your body's going to retain a lot of water because it needs to cool your body down. Okay. And so, if you're trying to lose weight in a situation, a hot, humid area, you're going to see a lot of fluctuations because a lot of times you're going to lose the water weight. When you go indoors, then your body cools down, then your body releases water, and you're going to be urinating like crazy, at least once an hour, maybe once every 30 minutes. But then you keep on drinking, right? So the weather of where you live matters. It can affect, and your body has to adapt. Now, obviously, if you lived there for years, your body should have adapted. I just came into this environment, so my body's trying to adapt. Okay. Uh, all right. So we've got some people tuning in. I've only got about 14 more minutes. So Leanne, thank you for joining. Osteoarthritis all over and extreme pain. Which joints are most painful for you, Leanne? If you can type into the chat, which of the joints? Because I'm going to assume it's going to be lower body or your spine because those are most of the wear and tear. So let me know, Leanne, okay? And I'll just keep chatting about it when I see. So osteoarthritis is a degenerative form of arthritis. It's a wear and tear. So for those of y'all who don't know, there's also the rheumatoid arthritis. So the two main categories of arthritis, there's osteo, there's rheumatoid. Rheumatoid is a autoimmune. It's where your body attacks your own joints. Osteoarthritis is not an autoimmune. It is a wear and tear. So let's say you use your hands to, let's say you're kneading, you're making some noodles every day, and you're just using your hands, gripping the dough, and you just use it wear and tear, right? That's when you start losing the cartilage in between the joints. All right. The cartilage is like cushion in between your joints. That wears down when you overuse your joints, right? This is why I tell people, when you look at people try to imitate professional athletes, like they think professional athletes are healthy, which they are not. Um, and they imitate, bodybuilders, and they're not healthy. Hands and arms lately. Oh, okay. Okay. So hands and arms lately. So I'm talking about the hands. Okay. So great. So don't mimic professional athletes. Whatever they do, you should not be doing. Okay. Whatever, fitness people are doing, you should not be doing. They're not healthy. They may look healthy. Especially in the US, there's a bad problem about looking healthy versus being healthy. When someone looks healthy, like there can be an obese person that is more healthy internally, right, than an athlete. I know it sounds crazy, but that's we're talking about sustained function, right? But coming back to arthritis, so if you lost the cartilage in between your joints, especially your hands, right? You said your hands and your arms, it should be your elbows and your wrist. Then number one, there's not much that can regenerate that cartilage. So it's important to make sure a couple of things. Let me start with the first thing. It's important to do strength exercises. Yes, I just talked about don't be like those fitness people, right? Yes, those fitness people, they're lifting weights, they're doing weights too much. But the normal person, you still need to lift weights. Here's the reason why you need to lift weights. Okay. The reason why you have a lot of wear and tear in your joints is because you are using your joints are bearing the stress of your daily activities. So if I take my hand and I'm, making pasta, or I'm making a cake, or I'm actually making noodles, right? Making some dough and I'm gripping, right? The the part of my hand that should be doing most of the gripping and should be the muscles, right? The muscles in my fingers and muscles in my hands. The stress should not be on your joints. The joints are not made to bear with a lot of stress. Maybe the hand's not a good example. Let me go down to your knees. The knees are the most common area of osteoarthritis. So the knees, too often, because we don't exercise our quads, so our muscles. Let me just show. Sorry, apologize for jumping around. I can show my arms better. So when you don't exercise the muscles in your arms, right, then the stress goes onto this joint, your elbow. So it's a bone touching bone. Now, this elbow is not supposed to bear a lot of the stress of your daily activities. Like if you're lifting stuff, right? You shouldn't be using your elbows, your joints, your wrists to lift stuff. It should be your muscles and the muscles in your forearm. It should use these muscles are supposed to bear the stress. And that's why when you lift a heavy box, repetitively, you'll feel your muscles are sore, right? Which is correct. It should feel sore because if your joints start hurting after you do something, you lift something, then that means your muscles are way too weak. And that is a very clear indication that you need to do strength training. Now, strength training is not to get buff. It is to just increase the size of your muscle so that when you go, and let's say this thing is heavy, I'm lifting it, then I'm using my muscle and not my elbow, not my shoulder joints, not my wrist joints to lift this heavy thing. I'm using my muscles. Okay. So, Leanne, this is a good indicator. If your joints are they hurt after you do something, you lift, maybe even you write with a pencil, right? That's a clear indication your muscles are weak. You need to strengthen your muscles. Now, you may be asking, how do I strengthen my muscles in my hands, right? They're so tiny. Well, there's those grip machines, right? You can even grip this. Like this is stainless steel. So what you could do is you can just grip it really hard, right? And then relax. Grip it really hard and relax. But they have these grip exercise, right? They look like these two-prong things, and you just grab them and you just squeeze them, right? Those grip, or even a stress ball. There's so many stress balls out there. You can just squeeze that every single day and do it, as many times as you can. You'll notice after a week, if you do this every single day, right? And just when you're watching TV, grip that stress ball, right? After a week, you'll start to notice you'll wake up with less joint pain in your hands. Okay. All right. So that is osteoarthritis. There's so much more I can talk about osteoarthritis, but we're getting more people asking. So I'm going to talk about other problems too. Leanne also mentioned fatty liver disease. Okay, so fatty liver disease, you have to find the cause, right? Most people think fatty liver disease is due to alcohol. Actually, what's on the rise is something called NAFL, non-alcoholic fatty liver disease, right? And so fatty liver disease, what are those? What are the non-alcoholic fatty liver disease? Sugar. Sugar is the cause of that most of the time. Okay. Now, if you are ingesting a lot of toxins, um, I would say two things, sugar and toxins. Now, sugar, let's talk about sugar first. So, sugar is any type of sugar, right? But more specifically, the processed sugar, the white sugar. So, if you have fatty liver disease, even if it's alcoholic based, right? Which most are not these days, you need to get rid of all the white stuff. White rice, white bread, white potato, white noodle. You need to get rid of all of that. There is no exception. Unless you want your fatty liver disease to get worse, some when patients come to our clinic, they're like, "Oh, but can I eat a little?" I'm like, "You can do whatever you want. It's your body. It's your hand that you're putting food in your mouth." But let me tell you what's going to happen. You need to choose. You need to choose. Do you want your fatty liver disease to get worse, or do you want to have a temporary indulgence of cake? It's your choice. I can't make that choice for you. But let me tell you the consequence of your choice. If your fatty liver disease gets worse, your fatty liver disease could develop into liver cirrhosis. Liver cirrhosis is when your liver becomes so hard it does not function anymore. What happens if you develop liver cirrhosis? If your liver stops functioning, your body will lose the ability to detox. The liver is one of the most important organs to detox your body. It allows us, like we put stuff in our mouth every day that we don't realize. Even a lot of the synthetic foods, like man-made salmon and all that stuff. We put all those things when we go out to eat. When you go out to eat, you don't know what you're putting in your mouth, but your liver keeps you alive. Your liver detoxifies whatever you put in your mouth, right? Either by mistake or by choice. If your liver stops functioning, right, that is a huge problem. that it becomes very, very severe, life-threatening. So you get to choose. Do you want cake or you want to die? It's pure and simple. Okay. So you want to reduce. Now you may ask, oh, what about sugar? What about fruits? Fruit sugar. No fruit juices. Those are just worse. They're worse, actually, fructose. You're just getting fructose. They're worse than the white stuff. But you can eat fruits. You can eat them as a whole. No juicing. Eat the fruits as a whole, but you can blend them. Okay. So fatty liver disease is, you should treat it like diabetes. Actually, most people with fatty liver disease, I bet you their blood sugar is elevated, right? And that's what we see in our clinic. So I would treat it like you have diabetes. Okay, I hope that helps. Laura Hutchinson with Parkinson's. Okay, so I'm thinking, Laura, that you're asking how do you, live with Parkinson's? How do you, if you have Parkinson's, how do you, slow it down and how do you have a better quality of life? I'm assuming that's what you meant, okay? Let me know if that's what you meant, okay? So, Parkinson's. So Parkinson's nervous system disorder, right? Uh, it's inflammation. There's a disconnect. There's a short circuitry, and I call it short circuitry. I'm just trying to use these analogies so people can understand better, right? And so has my clinic and my team, have we reversed Parkinson's? No. So I cannot tell you how, we've reversed Parkinson's or not. We have not reversed Parkinson's before. But have we slowed it down? Yes. Have we slowed it down? Have we helped some patients with Parkinson's be able to have a better quality of life, right? So they're not Parkinson's. For those of you, there's different. Parkinson's is a type of tremor. For those of you who don't know, it's mostly a tremor at rest. Okay. There's also, they'll shuffle their feet, right? And it affects actually their memory, their comprehension. And so it's a central nervous system problem, right? And so let me just distinguish, because we neurology is our specialty in our clinic. And we treat various types of tremors. There's two types of tremors that I'll just, for the other people who don't know. There's tremors when people are using, like they're grabbing something, they'll shake. When they're moving their hand, they'll shake, right? And then there's Parkinson's where it's at rest. When their hands are not moving, they'll shake, right? They'll shake and they can't control it. Okay. But when they start moving, right, the shaking goes away, or they may still shake a little, but it's less. Okay. So that's the two types. There's shakes, there's the tremors at rest, and then there's tremors during movement. Right. We've had really good success with tremors, like essential tremors with movement. So when people are putting their glasses on, they can't, they're shaking like this, right? So we've had really good success with that. Okay. But Parkinson's, the way we slow it down, it's you have to decrease inflammation from your nervous system, right? Going back to the fatty liver disease, you should also treat it like a diabetic. You should make sure that your blood sugar is good. That's the first thing, because blood sugar can cause inflammation. You also want to make sure, I forgot about the other toxins with fatty liver disease, toxins. What toxins people don't realize is the medications. If you take a ton of medications, that's toxin to your body. So same thing, toxins to your body can cause inflammation, which can exacerbate your uh, Parkinson's. So the liver organ, this is actually perfect. What we have helped people slow down Parkinson's is to address their liver function. Most of the time, when we treat Parkinson's, people with Parkinson's, their liver is dysfunctioning. Okay, it may not show up in the blood labs, but the liver controls, right, your tendons, your ligaments. It can affect your nerves, your actual nerves, right? So you want to make sure that your liver is functioning. You can do the basic blood test, test the liver enzymes, make sure they're not elevated, AST, ALT, GGT, make sure they're not elevated. So if they are, address that first. Now, if the liver's okay, then the next one is your kidneys. The kidneys is probably the most important organ for Parkinson's. Now, follow me for a second, okay, Laura? This is going to sound weird because in Western medicine, they won't admit this and they'll say there's no research behind this. 3,000 years ago, Chinese medicine found that the kidneys have a direct influence in the brain, to the brain. We call the brain the sea of marrow, okay? Um, just direct translation. So the sea of marrow is the brain, and the kidneys control the sea of marrow. So people with Parkinson's, when we treat their kidneys, it slows down the progression, okay, significantly. Does it reverse it? We have not figured out how to do that. But we can slow it down by making sure the kidney function is good. Okay, your kidney function. So, Laura, those are the two things that I would suggest is really focus on your liver function. You need to do all the blood tests, even ultrasound your liver, make sure you don't have fatty liver, make sure there's no growths in your liver. And then number two is your kidney function. You can do a urinalysis, you can also do blood tests, comprehensive metabolic panel. These can also give you clues. They don't tell you everything. Blood tests and Western medicine diagnostics do not tell us everything about an organ. They give us clues, which are important. Neither does Chinese medicine. Chinese medicine diagnostics don't give us everything. That's why I like to combine. That's why in our clinic, they use the word integrative. We fuse, right? We fuse Western medicine and Chinese medicine. So those two things, okay, those two organs, I would focus on those and help restore those. Joanna, awesome. Joanna from Canada. So this should not be too late for you. I mean, too early for you, right, Joanna? I know my other time was too early. Thank you for joining in. Stress headaches. Okay, I'll end with this. Stress headaches. Stress headaches come from your neck. Okay, they come from your neck. You think it's from your shoulder. I mean, yes, it's your shoulders, right? Your shoulders are tight, and they pinch on the nerves, right? They pinch on the nerves that go over your head. Stress headaches, usually you feel it from your neck, and it wraps like this around the side and also a little to the top, right? And then eventually it goes into your temples. There are nerves. So, Joanna, follow me here, okay? I mean, just follow. There are nerves that are connected to your gallbladder that go up your shoulder that wrap around your ear, okay? So the first thing I would do, there's two things I would do for your stress headaches. Number one, for symptom relief. For symptom relief, you want to address it's coming from your spine. There's pinching of the nerves in your spine. These nerves, they come out to your shoulder. They come out from your neck into your shoulder, right? And that's why it's causing your shoulders to tense up. So there's impingement on your neck. In this situation, I would suggest you do chiropractic first, right? Do chiropractic so they can relieve any type of pressure that's on the nerves that are coming out to your shoulder, right? Um, that's the first thing. Then the second thing is then I would do, if you have an acupuncturist, then I would go to acupuncture to stimulate your nerves to reconnect and the blood circulation. Okay. So that's what you can do. But let me share with you what I can do help with you right now. QRA. We're gonna use our hand today. So this is your head. The hand is your head. Okay. You're going to go, and this could be the back of your head. So it's like this, okay? It's like this. So front of my head, back of my head. See, back of my head, right? So your stress headaches, when you have those tension headaches, right? You're gonna go to here between the fifth and the fourth. So this is QRA. This is not acupressure. This is what I created, okay? Quick restorative acupressure. So between the fourth and the fifth, and then between the second and the third knuckle, right? You're going to start from the top of the knuckle and you're going to press. See, I'm pinching like this. I'm just pinching like this. And when you get that stress headache, right, you're going to start find the tender spot. You're going to go all the way down and you're going to feel you're going to hit bone, okay? Then you can stop right there before you hit the bone. You're going through in between the space. So you're going to first go between the fourth and the fifth digit knuckle, and you're going to go down and find a tender spot. When you find that tender spot, you're gonna dig in, you're gonna pinch on it for 30 seconds. You're gonna massage it, okay? And you can move your neck around at the same time. Pinch it, move your neck around. See if it decreases it. If it decreases your tension headache, you got the right spot. Then what you're gonna do is you're gonna push on it again, okay? You're gonna make it hurt again, and you're gonna rotate the other direction, okay? You can do this for another 30 seconds, right? And then just relax and just sit there, right? Let the body work because you just stimulated the nerves. You just sent a signal to your brain to tell your brain, hey, relax, relax my shoulders, relax my neck. Okay. See if that works. If that doesn't work, remember, next thing, go between the second and the third knuckle. You can do the same thing. Okay. You can do the same thing. You're gonna I can do it better this way. So you can do the same thing and you're just gonna push, right? Push until you find the tender spot, right? Between there. Do one hand first. If this hand doesn't work, use the other hand. Okay. The hand is very sensitive. That's why I like to use the hands and feet because the hands are sensitive and because we have more sensitive nerves. Sensitive nerves work faster. Sensitive nerves sends a message to the brain faster, right? It works faster. Does it hurt more? Absolutely. Okay. That's why it works faster. So now, if those don't work, you're probably wondering, can I go between the third and the fourth digit and work down here? Absolutely, right? You can do that too. It's just harder to get into in between the space, right? So that is one way of doing it. Okay, awesome. Thank you, everybody, for joining in on a different time. Again, like I said, for the next 3 months, I will be here in Taipei. So I will be at this time. I will still be doing this QRA. Hey, it doesn't matter where I am in the world. I will always be here to help y'all, support y'all. This is my way to help the people that all over the world that can't come to our clinic. If you can, please come. You're going to get the best results. But if you can't, I'm using this way, YouTube as a way to help you. Okay. So next Sunday, 5 p.m. Central Standard Time. That's next Sunday, 5 p.m. 5 p.m. Central Standard Time. I'll see you here. All right, guys. Thank you again.